Hi, I'm T.T. Perry, Ph.D. I'm an applied and translational sensory scientist, and I'm here today representing the Genital Autonomy Collective. This is a video presentation of a poster presented at the GLMA 43rd Annual Conference on LGBTQ plus health in Minneapolis this past October in 2025. Please settle in while I walk you through our poster, titled A Thematic Analysis of Transgender, Intersex, and Gender-Diverse Experiences of Violated Genital Autonomy. Let me just get out of the way here. Let's zoom in on the background. Right. The Genital Autonomy Collective is a transnational peer network of transgender, intersex, and gender-expansive people. The idea of genital autonomy is that one should be free to pursue the changes to their genitals that they'd like to pursue to be more comfortable in their body, and people should also be free from forced changes to their body, and especially their genitals, that they don't want. Because genitals are both deeply personal and highly relevant to one's identity and interpersonal relationships, violations of genital autonomy can have really big consequences for your body, for your gender, and for your self-realization. Let's just check in on what the bioethicists have to say about genital autonomy. So let's look to last year. A collaboration of bioethicists and human rights advocates got together and released a statement, a paper. In that paper, they say clinicians should not be permitted to perform any non-voluntary genital cutting or surgery in prepubescent minors, irrespective of the latter's sex traits or gender assignment, unless urgently necessary to protect their physical health. And indeed, this statement is necessary because genital cutting sufferers are systematically disenfranchised by our healthcare system. In fact, non-voluntary genital cutting is the most common class of surgical procedures performed in the US. People who are harmed by unwanted genital cutting include children with intersex traits who are forced into quote-unquote normalizing surgeries, as well as children forced to go other forms of normalization, such as penile circumcision, clitoral reduction, or vulvar modifications. And these modifications are not universally liked. In fact, roughly 1 in 7 American circumcised men resent the genital amputation that was forced upon them. And non-heterosexual people with penises are more likely to resent genital cutting than heterosexual men. Despite this, we have seen only a small decrease in the number of non-voluntary genital cutting surgeries performed in the US. And that's troubling because we know that circumcision, for example, is medical harm. Here we're highlighting 2 different analyses that show that uncircumcised children have lower rates of penile problems than children who are circumcised, and the complication rate for penile circumcision is over 10%, with the doctors who did the analysis saying that that was higher than they expected. In fact, 1.5% of circumcised children required a second surgery. So circumcision isn't saving time or money, and it's not even preventing surgeries, it's causing them. So this project came about because we were inspired by a call for papers by the Journal of Bodies, Sexualities, and Masculinities. They were asking to know more about global debates around circumcision and anti-circumcision. So as a collective, we talked to each other and said we could definitely speak to these issues, and what do we have to say? So we came up with these 5 questions that we felt would probe our experiences and be relevant to hearing about these debates. These questions are: what is your positionality? How does your gender affect your experience of genital autonomy or intactivist spaces? How does circumcision affect how you relate to your identity or identities, especially intersex, transgender, and gender-diverse identities? How does circumcision affect how you relate to other people, especially in gender-diverse spaces? And finally, how does circumcision affect your gender transition or gender-related goals? 8 members of the collective volunteered to draft testimonials and become authors on this project. They are my co-authors on our paper that we submitted to JBSM and which we got encouraging peer review feedback from. And they're also the authors of this poster. After we wrote our testimonials separately, we came together online we exchanged our drafts with each other, and we met to discuss the themes and messages in our narratives. And so what you're seeing on this poster are the themes that we selected based on that discussion that we feel are most important for understanding our lived experiences and for providing clinical care in context. Now, this isn't a study that involves null hypothesis significance testing. Instead, we'd like you to just think about whether or not the clinical practices that you're used to are in alignment with the advice of bioethicists, as well as how they impact or play into the issues and problems that we highlight in our testimonials. All right, we're going to scroll back up here and start with our question about positionalities. So first and foremost, what you should know about the authors is that we're a diverse bunch. This is true in terms of neurodiversity, in terms of our sex, gender, and sexuality, and as well as our religion and cultures. We endorse having autism, PTSD, ADHD in various measures, gender dysphoria. Some of us are intersex, some of us are transgender, some of us are intersex and transgender. Some of us are women, some of us are just not a man. Some of us are gay, some of us are bisexual, queer, not doing gender at all, gender fluid. And in terms of our religious and cultural upbringings and backgrounds, we include people who grew up Mormon, Jewish, with Muslim parents, Catholic parents, American Christian parents, people who feel cut off from their spirituality or otherwise questioning or looking for answers, or who may even feel distance from religious community specifically because of genital cutting. Now, to get to the real meaty, juicy part of our testimonials, our experiences with so-called intactivism, our anti-circumcision activism that emphasizes intactness. Overall, we would say that we've had a lot of negative experiences online with so-called intactivists. Their online spaces are not welcoming for trans women. There's some misogyny, there's some anti-Semitism, and you just kind of experience microaggressions in these spaces as someone who is not a cis man. This is not to say that anyone who does anti-circumcision activism is a misogynist or an anti-Semite. That's not true. There's a lot of support for bodily autonomy amongst intactivists, and some support for gender-affirming care. And in fact, one of our authors endorsed being a teenage intactivist before they became a genital autonomy advocate. And we do see some support from intactivist organizations. So not just the kind of online guerrilla activists, but people who have established nonprofits and who have given us as a Genital Autonomy Collective support in our advocacy. And that's important because not all genital cutting sufferers are male. And so it's important to see that these anti-circumcision organizations are supporting circumcision sufferers who are trans, who are intersex, or who are otherwise gender diverse. This includes the Genital Autonomy Legal Defense and Education Fund, as well as Intact Global. We'd like to see more support for genital autonomy amongst those who consider themselves supporters of bodily autonomy, but unfortunately we haven't seen that yet. The support that we've received has primarily been from intactivists, which may surprise some people. And there were some testimonials that would like to have more expansion in terms of theological and religious thinking to provide comfort for people who are affected by unwanted genital cutting. So how has unwanted genital cutting impacted us as trans, intersex, and gender diverse people? We identified in our testimonials that sex and gender is a key site of harm for unwanted genital cutting. Penile circumcision, for example, was almost universally seen as something that marks the body as male, as masculinizes the body, as something that is harmful when done to girls, or even illegal when done to girls, but is approved when done to boys. Someone felt like the trauma of circumcision may have had a role in developing their identity as not a man. And someone who is gender fluid mentioned that having unwanted changes to their body disrupted and interacted with their gender fluidity. One author commented that penile circumcision delayed their ability to accept themselves as intersex because genital cutting of the penis is so normalized in society. And it's not just that we see this as being a gender assignment and it's introducing dysphoria, but genital cutting has deep impacts on people's self-actualization and can result in lifelong trauma. People endorsed feeling violated. They endorsed feeling cut off from intimacy and spirituality. It added unnecessary layers to a painful and confusing journey of self-discovery. People have PTSD symptoms, feeling triggered by the presence of children or other reminders of unwanted genital cutting. One person commented that they felt obviously mutilated. And it's not just problems or trauma that occurs to the individual, but in fact, our testimonials identified that trauma reaches beyond the individual and touches everyone that person interacts with. That there are permanent effects, not just on the body, but on relationships between parents and children. It's a stigmatized topic, and so our grief about what was done to our bodies is disenfranchised and dismissed, set aside. It's not just the bonds between parent and child that are disrupted. That trust is also shattered between patient and healthcare provider, which is particularly problematic for those of us who are seeking gender-affirming care, such as additional genital modifications. It requires a level of trust to have someone cut upon your most intimate part of your body that way. And if you feel like you cannot trust someone because the healthcare system has already violated your body, that makes pursuing gender-affirming care that much harder. And in fact, our testimonials emphasize that penile circumcision normalizes violations of patient dignity. The logic of circumcision, of acting upon a body without assent, is not just contained within that surgical act in childhood, but in fact, we see that that informs how the healthcare system treats people who have been forced into unwanted genital cutting. In one testimonial, a person endorsed having experienced sexual battery when they were forced to go to a doctor to discuss foreskin restoration that they were doing themselves. Another told a story about how a therapist disrupted or violated patient confidentiality by bringing the patient's circumcision grief up in a session with their parents without their consent. And lastly, an orchiectomy surgeon who rejected the need to address circumcision trauma re-traumatized a patient who was pursuing gender-affirming care. These are big problems that represent the consequences of violated bodily autonomy. And overall, the emphasis that we had in terms of what is the interaction between unwanted genital cutting and gender transition or gender goals is that penile circumcision, in particular, is enmeshed with dysphoria. There were people who described two different kinds of dysphoria that are highly related. Iatrogenic genital dysphoria from gendered genital modifications, and gender dysphoria, which may involve the genitals or other parts of the body, that is specifically about dissatisfaction with the gendered body. These are two highly related ideas, and when your body has been acted upon in a way without your consent, you have to untangle what came from the unwanted surgery and what is naturally what your body feels. One person concluded that dysphoria related to being circumcised contributed to the difficulty in determining what their transition goals were. Now, we are a group that is focused on autonomy as the Genital Autonomy Collective. So something that we support in our peer support groups is foreskin restoration. And this is something that may be confusing to people who think, well, the people who've experienced penile circumcision who are trans, aren't they pursuing vaginoplasty or other genital modifications anyway? And the answer is some of us are, yes, that's true. Some of us have pursued that, and some of us are pursuing that in the future. But there's still a role for foreskin restoration as a part of gender-affirming care. And for those of us who are keeping our penises, it's straightforward that wanting to have a body that we feel comfortable in is something that can be done through foreskin restoration. And for those of us pursuing vaginoplasty, having additional genital tissue makes it less likely that the surgeon will need to take a graft from outside the genitals. So it's a way of having more genital tissue at the end of the gender-affirming care. In fact, there is a purpose for foreskin restoration for trans men as well. Trans men may find that upon testosterone, that the growth of their phallus outpaces the growth of the skin system of their phallus, and that they may experience chafing. By doing foreskin restoration, trans men can reduce this chafing and provide more coverage. So, one thing we want to emphasize is that even as young children, members of the collective didn't feel right in their bodies, particularly did not feel right being circumcised. Age 6, age 7, children were exploring their bodies, paying attention to the signals, the sensory information coming from their genitals, and trying to be more comfortable. Now, this is something that's happening in response or after the fact of an intervention, but as members of the collective, we believe that this is a practice that all children do from in one form or another, trying to understand their body and feel comfortable in their own body. So we think that we should pay attention to this, and not just as a response to changes introduced by a surgeon or a medical care provider, but just that children may naturally not feel comfortable in their body. For example, if they believe themselves to be trans, or to have a gender identity that's different than what they've been assigned. We should respect those subjective feelings of discomfort and pay attention to what the child wants to feel comfortable. One author stated that they loved the idea that I have traded my testicles for a foreskin. I just can't help wishing that if I was going to have genital surgery as an infant, it could have been an orchiectomy, removal of testicles, instead of a circumcision, removal of the foreskin. So altogether, what is the grand theme of our testimonials? It's subsidiarity, which is defined as decisional authority should devolve to the lowest level decision maker, consistent with satisfactorily completing the task or role at hand. The person best positioned to judge the desirability of any genital modification is the person whose genitals would be affected. We believe in the case of both circumcision and gender-affirming care, the youth should decide. Medically unnecessary genital modifications are not ethical to perform without the patient's assent at a minimum. And parental desire is not patient assent. Just want to emphasize that if a parent comes to you as a healthcare professional and requests a circumcision of their child, the patient in that case is the child, and if you do not have the child's assent, you should not proceed. That's because violations of bodily autonomy and integrity, including unwanted penile circumcision, can be deeply intrusive and profoundly damaging to the individual. In contrast, positive experiences of bodily autonomy, such as gender transition and foreskin restoration, are healing and empowering to the person. We really want to discourage anti-circumcision or anti-trans activism that emphasizes bodily naturalness or quote-unquote intactness, because that ignores the subjective experience of being in your own body. Instead, what we should really be valuing is the idea that every person should be comfortable in their own body, even if that requires making some changes based on their subjective experience and desires. Indeed, genital cutting of children is primarily a cultural and institutional right desired by adults and imposed on children in contexts of familial and social conformity. In contrast, pediatric gender-affirming care is motivated by children's self-understanding and desires in defiance of social or even familial pressures for conformity. All in all, as a diverse group, we'd like to affirm that regardless of the child's sex assigned at birth, genital cutting sufferers experience real trauma that should not be dismissed. Fortunately, we don't need huge leaps in science to address this problem, but we do need embodied engagement from healthcare professionals who want to disrupt unethical behavior in the clinic. Thank you for your time. If you'd like to know more about the Genital Autonomy Collective, you can visit us at autonomycollective.org. And if you'd like to support the Legal Defense and Education Fund, you can go to GALDEF.org, GALDEF.org.